Podium and welcome the President and CEO of the Global Health Council, Dr. Nils Dallaire.
Good evening, friends. It's another lovely evening, a wonderful night for celebrating, and a remarkable occasion as we celebrate the 35th Annual International Conference on Global Health with this award ceremony. There are a lot of people who have been involved in this. This is the largest dinner ceremony we've ever had, I think 700 guests, and thank you all so much for coming.
To present the Gates Award for Global Health this evening, we are honored to have with us Mr. William Gates, Sr., co-chairman of the Bill and Melinda Gates Foundation. A former serviceman, business leader, and accomplished attorney, Mr. Gates, Sr. has made a tremendous impact in the lives of many through his service to civic programs, business initiatives, and cultural organizations, such as the Washington State Bar Association, the University of Washington's Board of Regents, and the United Way of America, to name a few. At the Bill and Melinda Gates Foundation, he has been instrumental in directing the vision of the organization. He has also been one of the key architects responsible for bringing this award to fruition. Please join me in welcoming Mr. William Gates, Sr. to present the 2008 Gates Award for Global Health.
Thank you very much, Brenda. Wasn't that singing great? Yeah, just wonderful. Where would we be without music? Well, it's really a delight to be here this evening to present the Gates Award for Global Health. I want to thank Nils Dallaire and the directors and the staff of the Global Health Council for their life-saving work. One might be tempted to think that it was a happy coincidence for the Council when the world began to turn its attention to global health. But that was no coincidence. The Council was instrumental in making that happen. Thank you for your energetic advocacy for the cause of global health. When Bill and Melinda came to the Council to launch the Global Health Awards, they were inspired by two opportunities. First was the opportunity to support creative organizations that bring health care to those who don't have it. And second, the opportunity to highlight the original thinking that makes these miracles possible. Increasingly, we're finding that the most amazing breakthroughs are delivered by groups that have found out how to combine self-interest with concern for others into one system that serves people who used to be left out. This is creative capitalism, an approach where governments, businesses, and nonprofits work together to stretch the reach of market forces so that more people can make a living doing work that saves and improves lives. The organization we're honoring tonight has developed a system of eye surgery that is so efficient that the cost of the services is covered by the people who receive the services, even though most of the patients are poor and 70% of them are treated for free. In 1976, the founder of Aravind, affectionately known as Dr. V, retired at the age of 58 from a long career of service as an ophthalmologist for the Indian government. Working first for the Army and then for public hospitals, Dr. V had made his mark as a renowned eye surgeon, clinician, researcher, and a developer of community programs. Ordinarily, the retirement marks the end of one's career, and given all his accomplishments, retirement would have been justified. But Dr. V was just getting started. His first step was to ask his sister and his brother-in-law, Dr. Nam, who is here tonight and currently chairs Aravind, to join him in setting up a new nonprofit eye hospital. In India, leaving government service for the private sector usually means crippling one's income. For Dr. V, it meant mortgaging his house to provide Aravind startup money. Dr. Nam and his wife, to them it meant working twice as hard for half the salary, but the three of them were on a mission. During their government service, these pioneers had seen the devastating effects of blindness. Being blind in any rural village in the developing world leaves a person in darkness and dependence. They cannot earn income, they cannot assist in the duties of the household, they become a fundamental burden to their families, who are often already poor. And the problem was especially acute in India, a country with nearly 7 million blind people, representing almost 20% of all the blind persons in the world. But Dr. B and Dr. Nam knew that up to 80% of blindness was due to cataracts, which could be cured with routine surgery. From their point of view, if we know how to fix it, then no one should suffer from it. That's why they started to call it needless blindness. It doesn't have to happen, and they set out to make sure that it wouldn't. But there was an obstacle. Cataract surgery can easily cost more than $3,000 in the West. Millions of people they needed to reach couldn't pay even 1% of that. How could they possibly take care of them? Well, they started by opening an 11-bed facility with 4 staffers. They called the hospital Aravind after a famed Indian philosopher who believed that human beings, by exercising their sacred duty to help others, could harness a spiritual force in their work that would allow them to accomplish miraculous results. 30 years later, Aravind is the largest, most productive eye care system in the world. Last year, they treated approximately 2.4 million patients, and their doctors performed more than 280,000 sight-restoring cataract surgeries. More than 280,000 sight-restoring cataract surgeries. Thanks largely to Aravind's efforts, the estimated number of blind people in India fell an astonishing 25% between 1990 and 2002. All this came from a humble little hospital with 11 beds, 4 staffers, and 1 brilliant ophthalmologist who mortgaged his house to start a hospital inspired by his love of humanity and his devotion to service. I'd now like to tell you about the philanthropist whose generosity has made this possible. This is the point in this speech where this subject is usually touched upon. But there's no story to tell. No story to tell. Aravind's budget is almost 90% self-generated. How did they do it?